everyone. I'm Maggie Baker. I'm Dean of the School of Nursing and Health Professions, and I am really excited about this event. Let me go back a second. I go by she, her, and I'm really excited about this collaboration between the School of Nursing and Health Professions, the Graduate Nursing Association, the Nursing Student Association, and the Oncology Nursing Society. Collaboration is the key to everything that we do. It's all about relationships, advancing knowledge, advancing our relationships, and advancing goals. And so we do it best when it's together. And we really hear from other people. We learn from their perspectives. We draw on their knowledge and expertise. And we build in more and more networking and support for each other. I love the topic of self-care for this. As you know, we cannot properly care for others unless we care for ourselves. And that, I've been a nurse for a long time, and that is probably the hardest lesson to learn, is to take care of ourselves first. And then certainly, we do need to take care of those we're serving. And yet it's that, how do we find the time and the space and the energy to take care of ourselves and to remember to prioritize that? So I look forward to the presentation this evening and to the panel discussion. I'd like to thank everybody in all of these associations, and especially I'd like to thank Carolina Echeverria, our Director for Partnerships, and I'd like to thank Dr. Kathy Coleman, who's just a spark plug and a bright light, who's just continuously joyous and energetic. It's just amazing. And also, Erin Dickman, it's nice to meet you, and I'm looking forward to your presentation and to your part on the panel, as well as the other panelists. And I'd also like to thank the students who are our meeting facilitators this evening. So I'm going to mute myself here, and I'm really looking forward to staying throughout the event and really hearing what everybody has to say. Thank you, and congratulations on this joint event.
I'm absolutely honored to introduce Erin Dickman tonight. Erin is an oncology clinical specialist at the Oncology Nursing Society. And I mentioned our mission is to advance excellence in oncology nursing and quality cancer care. In her role, Erin utilizes her expertise to interpret oncology nursing and cancer care trends, develop resources and education to support clinical practice, and advocate for oncology nurses nationally. Her current focus is to ensure the present and future generations of oncology nurses are prepared to provide genomic care to patients. Erin obtained her undergraduate degree and master's degree in nursing from The Ohio State University. Erin has dedicated her career to oncology care and the advancement of the oncology nursing profession through her many roles throughout her career in patient care, nursing education, program development, and leadership. She is certified as an oncology certified nurse through the Oncology Nursing Certification Corporation because she believes that nurses should maintain current and highly specialized knowledge to be able to provide quality care. Erin is passionate about nurse well-being and shares her expertise as a co-author for the self-care column in ONS Voice, and has most recently formulated a self-care nurse learning library. Erin?
Thank you for the introduction, and thank you everyone for having me. It's been such a pleasure and an honor to work with all of you on this program, and I just love this topic. And so I think it's good. We're going to have a lot of fun tonight, and we're going to have a dynamic conversation on the panel. And really, I just think it's awesome that your professors and your college and program are thinking about introducing this concept of self-care to you and burnout, so you're successful in gaining these tools and way to think about stress and your problems before you get into your nursing career. This is really setting you up for success. I didn't hear a ton about self-care in undergrad, and it's probably a little bit more familiar for you, especially during the pandemic. I think it's really important that we talk about this a lot. But I started thinking about self-care when I did transition into my nursing career, because it just felt a little harder than it needed to be. I was like, this could be a little simpler. Like, what can I do? So I started searching for ways of self-care. And so I searched for myself and started advocating. And then that kind of trickled into helping my colleagues. And then I was leading culture retreats and helping the institution, with self-care and culture. And then I come to ONS and I'm continuing to advocate for self-care with oncology nurses and now working with all of you. So I'm really excited to share what I've learned with you tonight. Okay, so I know we probably are all thinking about something else and we just ran from a different event or a class. So we're gonna go ahead and take just a couple deep breaths. So we'll take them all together. So take a deep breath in, 1, 2, 3, and out. 1, 2, 3, and in, 1, 2, 3, and out. 1, 2, 3, in, 1, 2, 3, and out. 1, 2, 3. So breathing is really cool. It like lowers your heart rate, which we all appreciate. Such an easy way to de-stress. And if you add counting, guess what? You can't do two things at once. So whatever you were thinking about before, you stop thinking about it. So put that in your pocket as one of my first strategies that I'm introducing to you. You also might see this beautiful nature scene behind Take a Minute to Breathe. And that actually is evidence-based as well. Just looking at pictures of nature can help you de-stress. Obviously, the real thing is better, but sometimes you don't have access to that. So just a couple of little tips there. So as we start to talk about self-care, there are going to be some different words and terms that we're going to use. And I want to make sure we're all speaking the same language and setting us up for success. So the first one I want to introduce is self-care. So the practice of taking an active role in protecting one's own well-being and happiness, in particular during periods of stress. And then resilience. So this is the capacity to recover quickly from difficulties, also known as toughness. And then stress, the degree to which you feel overwhelmed or unable to cope as a result of pressures that are unmanageable. And because we're going into nursing, the nature of our job is that we have some different stressors that other people might not feel. So certain stress that nurses feel, compassion fatigue. We're caring for other people. So sometimes that combination of physical, emotional, and spiritual depletion associated with caring for someone else can cause significant emotional pain and physical distress. Another stressor is moral distress. Sometimes we're put in situations that morally and ethically we don't agree with, and that can sometimes wear on us. And the third one is nursing burnout. So a state of emotional, physical, and mental exhaustion caused by excessive and prolonged stress that manifests in emotional exhaustion, lack of motivation, and feelings of frustration. So the low of the low. So kind of how all of these tie together is we sometimes experience stress. We have certain stressors because we're caring for other people, and we need to make sure to identify that and have resilience so that we can rise above that. And how we do that is through self-care strategies. So let's dig in now that we're all on the same page. Like your dean said, we learn from each other and our experiences. So I'm going to share a little bit of my self-care journey and what helped me through these moments in my life. So as you can see, these are all big transitions. They're very clear in my mind because they were very stressful, but they were also, as I was reflecting on it, they were also life definers, right? What I chose and how I acted took me to that next step. And so I really want to tell you, stress and feeling uncomfortable is completely normal. It's just you can't stay there very long, right? You need to identify that and then get out of it. So again, put yourself in those uncomfortable situations, stretch yourself a little bit, just make sure that you have the right tools and that you're taking care of yourself. And don't beat yourself up if you feel stressed. Again, totally normal. We all feel stress. I felt a little stressed because I wanted to impress you tonight. I wanted to make sure that you got something out of this. You're spending your precious time listening to me. And so again, we all get there, but being, setting yourself up for success, being proactive. I practiced a lot to make sure that, I would do a good job for you all. So thinking about myself as a student, again, I feel like it could just be yesterday, just thinking about having, you know, going through the clinicals and wanting to get a job. And so some of the things I did is I realized I was signed up for a lot. I needed to say no to a couple of things. So that was one of my strategies. I really leaned on my mom. And you might have a different support person in your life, but she gave me the grace I needed to step back sometime. Honey, why don't you lay down? I mean, it was just beautiful how she did it. And I also found that even just running, even if I just had 20 minutes, running out 10 minutes, back 10 minutes, like that really helped center me. And then spending some time with friends. And then obviously the moments of interviews, just being proactive and making sure that I practice my interviews. And then as a new nurse and new grad, I asked for a lot of help. That was my strategy. I had an awesome preceptor. I had a great nurse residency program that extended my training. I had a nurse manager that I was able to go to and ask for questions. And then also, weirdly enough, watching funny videos with my coworkers, like it was awesome. It was just a little break from the day. And we all got to laugh together. Maybe I needed an extra couple minutes in the bathroom. You know, I was done, but I just sat there because I said you sometimes just need it, just a deep breath, a little bit of quiet. As long as your patients are all good, right? And then I was working night shift. Like, how do you learn to function on night shift? Blackout curtains, making sure no one's going to reach you during the day so you can sleep. Some days you're good at it, some days you're not. And then as a new leader, I definitely learned how to pause, right? Words, and especially as a leader, words modeling, like it means a lot. And so the pause really helped me before I would answer something. I just really thought about it. I planned out conversations in advance if they were going to be really hard and I cared about someone that I needed to coach them on something. At that point, I was walking back and forth from work. I was able to spend that time reflecting on the day, or maybe if I didn't want to reflect, I listened to some music that really spoke to me. And what really also helped me self-care wise was mentoring. I started a student nurse professional development program. So I had this beautiful program that I could mentor and build and support student nurses as they transitioned into their professional career. And so a big trend that I noticed, see, I'm still learning about myself too. A big trend I noticed is that a lot of the ways that I curtailed stress was I was proactive. Like I saw what was going to stress me out. I knew what triggered me, and I could make sure to practice or prepare to be better in that moment, so that I could leave knowing that I did the best that I could. And now, you know, I am a new mom. I'm in a pandemic. I'm in the second semester of my DMP program. And, you know, what I'm doing now, I'm still figuring it out. But a lot of it is Kroger click list. It saves me a lot of time. It is cooking new fun foods and just celebrating the small little things, doing yoga on my living room floor with my toddler crawling all over me, like, yeah, just doing the best I can. So that's kind of my journey. And as you could see, it was different things at different points, right? I couldn't take what I learned as a student and take it into my nursing career because my life was totally different at that point. So it's okay to change your strategies. So how heavy or how much do you feel like this glass of water weighs? 4, 8 ounces. So really the weight doesn't matter, but it depends on how long you hold it. So think about holding this glass of water for a minute, right? Like it's no big deal. We all do it. But think about having to hold it out for an hour. You know, maybe your arm starts to ache, or you hold it out for a whole day. Your arm might start feeling numb, or you might feel paralyzed from it. Think of stress and anxiety as this glass of water, and how long you hold it. You might feel numb at a certain point. And what if you're paralyzed, right? Like, what if you can't do anything because you're so paralyzed by the stress or anxiety that's overcome your life? And what happens if you have that stress and then you start adding more stress, more water to it, more stress? What if that water or stress spills over and then you're worried about the spilled water? Or, you're trying to hold it steady, but someone's trying to talk to you and all you're focused on is the water. You can't even focus on this other person. So just think about that. The longer you hold on to stress, the worse it is. The worse it is for your body, your mental status. And so the sooner we can kind of get stress off our plates or off our minds, the sooner we can get back to living a joyous, fulfilling life. So we know that you all have stress. See, I looked at the literature. I felt it. I mean, I could have probably come up with these things, but I like going to the literature because that's what us nurses do. So again, academic expectations, time management, clinicals, external stressors, like it does all add up. So I want to make sure that stress is normal. We're all stressful because we're achieving something big. And so we just don't want to hold on to that stress for too long. So I'm giving you the outcomes of stress because if you know it, you don't want to get there, right? Like, oh, I can prevent this, like definitely. So really outcomes of stress from the literature, reduction in spatial memory, it reduces cognition. You need that for clinical and taking tests, guys. I mean, like you can't be stressed. Ineffective communication, decreased reaction time, decreased immune system, risk for cardiovascular disease, GI issues, many other disorders come from severe and prolonged stress and decreased quality of work, including patient care and clinicals. So don't be that person. We can help. So let's talk about, a lot of people think that self-care is a lot of action and doing. And sometimes there's very powerful mental models that you can pick up to start thinking about your stressors. So one of those is using the circle of influence. This is from Stephen Covey's book, The 7 Habits of Highly Effective People. So every situation, he writes, can be divided into 2 circles: the circle of concern, which is the outside circle, and then the circle of influence, which is the inside circle. And those things inside the circle of influence are those things that you can control. So what you do is you try to realize which things go inside of which circle and then determine how much time you want to spend on them. So some things like the weather, the pandemic, the economy, those things are out of our control. It's really kind of a waste of our time and energy to focus on those. But other things like how we respond to certain people, your work performance, and whether you eat healthy or unhealthy, those are all inside our circle of control. So it's important to understand the circles shrink or expand depending on where we put our focus and efforts. If we focus on the circle of concern, we allow those things to control us. If we focus on the circle of influence, we are in the ones in control. And so the example that I'd like to give you is an interview. Stressful, right? We want to get that job. And so we cannot control who interviews us, right? They determine that. We can't determine what questions they're going to ask, but we can control preparation, practicing those questions, writing down examples, making sure we have questions we ask them, writing thank you notes, thank you emails, looking at the institutional website to make sure you know their mission and you can speak to it. So again, when thinking about something that you're really stressing over, try to identify if it's something you can control or if it's outside of your control. And if it is, I ask you to not spend time mulling over something that you can't control or you can't influence. So there's many different types of self-care. I know a lot of people go to the physical type of self-care first because that is something that we are familiar with. But when you're trying to understand what areas that you need to work on, you can think about all these self-care areas. So physical, emotional, spiritual, social, financial, and psychological. So I'm going to use a little bit of the nursing process because it can be applied to a lot of things and it's actually a really great model. So I ask you first to assess these areas of your life and what which areas that you might need to focus more attention to, and then kind of diagnose yourself. What areas can you improve upon? And if there's multiple, choose the one that might be low hanging fruit or the one that could make the biggest impact in your life. And so I wanted to, I know we're going to give you a bunch of great ideas as we talk in our panel, but I just wanted to throw out some other strategies in these areas of self-care. So physical, think about your annual physical exam, cancer screenings, healthy eating, sleep, exercise. I'm going to put vacationing in there too. There's a lot of research on taking vacations, and relaxation. Emotional imagery is not just for your patients. We can practice that too. Relaxation techniques, positive internal thoughts and dialogue. There's that little chatter in your brain, and it's telling you one thing or the other, and you can control that little guy or gal and say, like, I want to think positively about this. Like, this could be different, right? And then engaging in activities that promote joy. Spiritual, spend some time in nature, maybe do an random act of kindness, gratitude journal, some prayer. If you are part of a religious community, meditation, yoga. Socially, start having boundaries between work and home life. Spend time with loved ones, time for relaxation, speaking to a mentor or a community group. Financially, living fiscally responsible, preparing for emergencies, budgeting, borrowing, or buying secondhand. And then psychological, you can try coloring or making something with your hands. I mean, creating something, isn't that always just so cool? I learned how to crochet over Christmas because once you're in school mode, all that extra time, you got to do something with it. Activities that bring you joy and stimulate your mind are all great. And then again, just outside of this, connecting with other people, mentors, guides that are able to help you. And so really some key takeaways from what we've kind of reviewed in the short time together today is continually check in with yourself and your stress level. It's really important. I know that I need to focus on stress when I'm just a little bit more agitated. I lose a little bit more patience. I might not be adding in my schedule those things that bring me joy. So you figure out what those signs are when you really need to refocus on yourself. Your self-care journey is unique. It's your own. You have your own background. You have your own support system and experiences, and different things will work for you than work for me. Your self-care strategies may change over time. Certain things that worked for you at one point might not because your schedule might change. You might move to a different place or, your support system is different. Cultivate the self-care and resiliency tools you need. So when times do get stressful, you have those tools that you can pull out of your tool belt and use them. And then just ask for help when needed. Everyone has stress. It's something that we should all accept, and we should all be there for one another so that you don't have to feel that stress for a long time. So, and just lastly, if you're in an interview with, bring this up. What are you doing as an institution to support your nurses and their well-being and their emotional, mental health? I think it's really important that you are aware of those things because it's going to be important to make sure you're successful in that first job. So thank you so much. Here are my references as a good nurse has on their presentation. And then here is our panel. I'm gonna, I think, pass it over to Caitlin. Perfect.
Thank you so much, Erin. That was amazing, as always. It's very clear, I think, to all of us that you really know what you're talking about and you really just embody self-care in everything that you do. So we appreciate you being here. So the next portion of the event is going to be a panel discussion. So we have our 5 panelists. I'll introduce each of them briefly, and then we'll ask some questions. If any students have any questions that they want to ask to a specific panelist or to the whole panel, feel free to put them in the chat and we'll work them into the question section as well, okay? So obviously Erin will be one of our panelists. We also have Heather Battaglia, who is our GNA president-elect. We have Carly Feckley, who's the member of the Nursing Student Association. And then we have Alexa Altamirano. She was part of the BSN program, graduated in 2020, and she's now working at Stanford as an oncology nurse. And then we have Kathy Coleman, who is a DNP, RN, MSN, CNL, and CPHQ. And she is an associate professor at USF for the RN to MSN program. So we have a few questions to start, and I think initially we really want to open it up to everyone. Please share in the chat, and panelists, if you want to share as well. I just want everyone to do a brief individual assessment. As Erin talked about, there's a lot of different areas of self-care that maybe get neglected. So there are the physical, the spiritual, emotional, financial, psychological, and social. So just do a check-in with yourself and maybe identify an area of self-care that you want to focus on, or that you are like, you know, that's something that I haven't thought about in a while and I really want to address that. And feel free to throw it in the chat. And then a panelist, if you want to add in, feel free to speak about maybe some areas of self-care that you focus on or don't focus on.
Well, I'll start off because this pandemic, man, it has definitely caused some barriers to self-care. So the social interactions with friends just look completely different. I think that's one area that I'm still trying to understand, you know, and then also working remotely, breaking from that work to after work, and where is that barrier when there's always work to be done. So those are my, you know, my areas I'm working on.
I'll jump in. My areas are my just the expectations that I put on myself. So they don't actually come from outside sources, they come straight from me. And I think that that has a little bit to do with nursing being a second career for me. And, you know, giving up another career and pursuing this, I feel like I have to be great at it. And so I'm working on giving myself permission to be good enough sometimes and not have to be perfect or great all the time. Just to, sometimes it's okay to just be good at something.
I can add on to that.
Oh, okay.
Do you want to go?
It's okay. You can go first.
Okay. So for me right now, one of the biggest causes of stress emotionally is being a second semester senior and graduating. So I'm entering that, you know, big transitional period of my life where I'm going to be graduating, applying for jobs, and then adding a pandemic on top of it while applying to a nursing career definitely is a lot to handle. And adding on top of to what they said, I'm trying to like give myself kind of a break to recognize that, you know, there is a lot going on and I need to, you know, manage my stress and recognize that it's okay to be stressed and, you know, and figure out how to properly go about handling it. So
I'd like to add to that, Carly. I think it's wonderful what you just said, and it's true. These are all growing pains and transitions. And one thing that Erin pointed out was asking for help. And it's never too early to ask and to identify a mentor, even if it's for a little coaching session or networking. And don't hesitate to do that. Networking has been a jewel for me in collaborating, and even with my students. You can ask for help with your teachers, with your instructors for a little Zoom. I need a tune-up. I'm worried about a job. And that's how it happens. Networking.
I think that for me, I am a new grad right now. I'm in ONS as well. And my major stressor is definitely being a new grad. Like people don't really talk about like the how stressful it is, like being on your own at first. It's so exciting that you have a job, but then you're fresh out of nursing school and you feel like you don't really know anything. And that's just really scary. And definitely asking for help, not just from your coworkers, but also from my old professors. I have reached out to them, and they've been so helpful in like kind of navigating how I feel and like tips because they themselves have gone through the same journey. So it's something that I'm working on and definitely going through it as well.
Alexa, do they have a mentorship program, a buddy orientation program where you had your new job? Did they offer any support in that hospital? Or?
We just have a preceptor for the first 2 months, and I have like an oncology professional development mentor that I could reach out to. And we also have a spiritual care lady that comes and helps us kind of with reflection and all that too.
It's really nice to hear that, you know, like Erin said, it's really important to ask in your interview of what kind of support does your hospital organization offer? Because oftentimes I think it's a area of new jobs that's kind of neglected of you're getting training, but are you getting the like emotional and um, kind of like intellectual support that you need to be able to feel comfortable in that setting? Thank you all for sharing just kind of your initial self-assessments. With all of those in mind, a few questions that we have just about identifying stress and how to deal with it. So I think the biggest one that a lot of people have is how do you even identify what your stressors are? And do you start with the biggest one or do you kind of whittle away at the little ones that are more achievable?
I'll go first. I think the first thing to do is to name your feeling. I mean, there's so many feelings that we have. Is it frustration? Is it sadness? Is it loss? Is it anger? Is it nervousness? And just naming it, giving yourself permission to name what you're feeling, and then kind of address it. In my own head, I have a little thing. I reframe. I was taught by my best friend about gratitude. And so when I'm feeling down, I like to reframe and look at the positive side of things. But everybody develops their own little mechanisms.
Yeah, just to go off of what Kathy said, I think that, well, practically the first thing that I do, I'm a big fan of making lists. I think that once you know, just like see it all on paper, sometimes it can make you feel a little bit better and maybe it's not as big as you thought it was. But also, I think just reframing the thought process, like Kathy mentioned, I've been working a lot within the past couple of years of really identifying any negative thought patterns that I may be stuck in sometimes, because that can just make the list feel completely unattainable when it actually is attainable. So I think that once I have the list down and I kind of identify if I'm in a funk or not, I can kind of address from there.
Yeah, I just want to echo, you know, you might think that it's like your roommate or your husband that's stressing you out, but once I really got to know myself, I was like, maybe that was that conversation I had at work, or maybe that was that really sick patient that I just felt like I couldn't find that right intervention for, so really kind of understanding your triggers and understanding your emotions. And when your interactions with people you love just don't seem as loving anymore because they're the people you're safest with, right? Like that's when you're going to start noticing a change, or at least that was, what was big red flags for me. Like, Erin, come on, like do something different. And then And I think that was along Kathy's line, like naming your feeling, like naming, what is it that's stressing you out? Because if you don't know exactly what it is, then you can't find that intervention to help you. And then I will say some stressors take a long time to change. And you have to be okay with that longer process. I think about as a new leader, just feeling so overwhelmed with the meetings. And then also, like, my employees were like my family. And how can I not see my family every day? And just trying to be okay with certain things, and having to block out certain time on my calendar. Okay, is this making me feel better because I have time to round on my employees? And if that doesn't work, changing something else and trying something different, and just knowing it is a process. And it's okay if you try something and it doesn't work really well, because you can always try different things. But sometimes it is longer, and you just have to make those tiny changes at first.
Yeah, I think it's a really good point of, we always find new things that we have to deal with. And, sometimes you try something and it doesn't work, and that's okay. Like, you have to be able to just move forward and try something else. So with that, our next question is, a lot of times we set these goals, we make our lists, and we have all these ideas of what we're going to do to take care of ourselves. But sometimes we don't accomplish those self-care goals. So in times when we're kind of falling short, how do you prepare for better success in the next attempt?
So for me, when people talk about self-care, they talk about what Erin said, physical activity, like exercising, kind of getting your endorphins going. But for me, um, I have my Apple Watch, or I used to have my Apple Watch, and I would always just look at like the calories and like the heart rate. And I noticed that, yes, I was exercising, but I wasn't doing it for myself. I was just doing it to see how many calories I burn, or how many minutes, or like I was doing it more for the numbers. But I've definitely been going outside more, listening to a podcast, just walking outside. And that's what's really helped me.
I think this is Kathy. One of the things that's helped me is realizing that you don't have to be everything to everybody. And that I had a pattern of probably over giving because I wanted to help all the time. And you know what Erin said earlier is true. You got to take that little pause, and you've got to be able to learn how to say no, because you have boundaries. And that's why I go back to naming that feeling. Oh, I'm really tired. Do you have to work the double shift because they're stuck? No, you don't. It's learning how to say no. As a matter of fact, when I teach leadership, I give out little door prizes, and one of them is a no button. And we as a class learn how to say no in a million different ways just to get it out. So having a pause and having that, that red light, yellow light, green light, maybe you shouldn't be so impulsive and say this right now, or maybe I better take a deep breath. One of my students taught us a little trick in class, and she said a real quickie is to pretend you're smelling a rose and then blowing out a candle. And you can do that anywhere. And if you put your hand on your heart, it immediately relaxes you. So smell the rose, blow out the candle. Instant.
I love that. That's really cool. Another kind of same mental kind of trick is someone taught me is put your stress, visualize a leaf and put your stress on that leaf. And then just picture it floating down a river, like away from you. And that was a really cool activity to do. And it kind of gave you some peace, like, okay, bye, see ya. But another thing, one of my teachers just told me that I try to remember, and then sometimes I'm like, why don't I remember those things? Don't sweat the small stuff. And I know that's so much harder to say than to do, but no one might remember. You know, one of the good things I'm like, is it vain of me to think that they're thinking of me? Like, it just, you know, like they don't care, you know, exactly what I say. And then one of my favorite quotes about from Maya Angelou is, they won't remember what you do, but they'll always remember how they made you feel or how you made them feel. And I think that sentiment's true. Like, you don't have to be perfect. If you mess up, it's going to be okay. And just really reflecting and knowing and thinking about how you can do it better the next time, knowing that you can't change the past has really helped me move forward when I haven't achieved something, and not holding on to that stress for too long. And again, I'm not perfect, so I'm saying these, you know, saying these things, but we all falter.
Thank you all so much. I think it's so important to just acknowledge, like, it's okay to mess up sometimes. It's okay. Doesn't mean the end of the world. So another big question that I think a lot of people haven't thought of, because a lot of us have been in school mode for our whole lives. So I think we don't realize that, as like Erin, you were talking about in your presentation, of as your kind of the mode of life you're in changes from student to career to different career plus being a student to new mom, like how does your self-care change as you grow through these different stages and changes in your personal life and your career?
So I feel like I kind of took this one. So Dr. Coleman, if you want to kind of go through how yours has changed, that might be fun to hear.
Well, for me, humor's a big one. Laughing at myself. And I think, you know, I was 57 when I went into the master's program to become a clinical nurse leader at USF. And I was really scared. And I said, if I don't get an A this semester, I'm dropping out. I was really hard on myself. But I found my instructor, took me under her wing, and she said, hey, it's okay. And she taught me about Ignatian pedagogy, the 5 principles of understanding context, life experience, reflection, action, and then evaluation. And I had really never thought about reflection. And so I think reflecting where you are and where you want to go. And I never expected to get a doctorate, but she insisted you can't teach without a doctorate. So off I went. And that was another stress. But I made it at 62. So it can be done. And I think reaching out to ask your instructors, you know, don't be afraid to ask for a little Zoom. I've had many crying sessions with people on Zoom. They feel comfortable. It's okay. And especially if you have small classes, reach out, share your heart.
Yeah, I'll go off of that too. So I have transitioned to in a couple different phases, just from undergrad to career and then going back to school now. I feel like I've learned the most by making mistakes, really, by totally neglecting my self-care and then coming back to that awareness of, wow, I really need to pay attention to this. This is really important. I think that it's taught me to have that awareness in each phase of my life, and it's not going to look different, or it's not going to look the same in every phase. So I think just being aware, trying to know where just where you can make improvements, where you can find some time to buy yourself a Sunday if it makes you happy. Just like find the little things where you can, and then it'll come as you go further into that stage.
I'll go off what Heather said. I think being aware is super important as well. I like go home from work and I try not to think about work when I get home, but sometimes I can't help it. And It's like super important to just kind of be in tune with how you feel, and recognize like, yes, I just had a death of a patient and it was really, really hard. And we knew that patient so well, and it's really sad. And I used to go home and like cry, and which is, it's normal, but it's not really a good thing to do. So just like kind of what Erin showed in the slide, like what I can do, um, I started journaling and just writing down like things that make me happy, things that I can, goals in my life, like things that I can take control of, and just trying to reframe again how I feel about different situations that are stressful.
Yeah, absolutely. Of just find some way to constructively deal with your emotions and your feelings, and especially in oncology nursing of uh a lot of times there is death, and that's something that we have to deal with. And Erin talked about compassion fatigue and moral distress, and that can be really prevalent, especially in the nursing field. Which kind of leads into my next question of, we've all chosen this career of really dedicating ourselves to caring for others. And at least personally, I find it very hard to overcome the drive to put others' care needs before your own. I feel like it's very inherent in a lot of us. So I'm wondering if you all have any tips for how to kind of put yourself first sometimes, and remind yourself that it's okay to be a little selfish. It's a tough question, I know.
For me, Caitlin, I think there's a saying that you don't know what your limits are until you go beyond them. And as a young nurse, I was touched by what Alexa just said, because I love oncology nursing. And I was an ER nurse first, and I saw one too many suicides and people hit by drunk drivers and domestic. So whatever aspect of nursing we pick is going to hurt. And so we have to be able to cry, and we have to be able to grieve, and we have to realize that nursing is the gift that keeps on giving, because every loss and every patient that we help gives us a little bit more credit in our account of compassion. And if you can maybe look at it that, yeah, that death was hard, that pandemic, those ICU nurses, they're giving their all. We need to take care of ourselves and reach out to each other and put those boundaries around it. But everybody, I was an ER nurse, and I wanted to specialize in oncology nursing because the most vulnerable, intimate moments in life can be at the time of death. So, take that leap of faith and have that courage to cry and take care of yourself and to refresh and go back. So, Alexa, welcome to the profession.
I felt the same way towards Alexa's and what you shared. I mean, I felt the same way. There's just nursing and taking care of someone is such an honor and a pleasure, but it can be hard. And especially, giving of, I mean, you're kind of giving of yourself to that person and becoming their family in a way, and they lean on you, and it's great and fulfilling, right? The other side of compassion fatigue is compassion satisfaction, and I was going to add that term, and then I was getting long list of terms. We could have gone all day, but that compassion satisfaction is the rewarding part of nursing and why we are all in this profession, and so we shouldn't lose sight of that. And then to go back to Caitlin's question, I think what's worked for me to make time for myself is to have like an accountability buddy, or just like tell my family, like, this is what I need. Like, we all need to make time for what, and that helps too, right? You're not stealing time, you're planning time, and you're planning it and it works for everyone else too. And so I think just verbally, and it's just like asking for help at work, ask for help at home too. It's hard and you sometimes need to lean on your family, and just being open and honest about that before it gets to the point where it's to a point where you can't dig out, you can't see that bright light, to get up there. So I also schedule time. Again, I work more of like a desk role right now. So I block time on my calendar. Specifically today, during a staff meeting, went for a walk outside. Walking is one of my like go-to joyful activities. It's so easy. You can do it, almost anytime. So I just make sure to have those easy small wins. And multitasking isn't real, but I feel like moving physically, you can still pay attention to a staff meeting. So I was like, win-win.
Kind of adding to what Erin said, I think dedicating certain times of the day or like even just one day out of the week to have your own time for yourself. It might sound silly, but like every now and then I'll designate like a Carly day where I literally like I'll be in bed, watch TV, go for a walk. Like if I'm at home with my family, I'm like, I just need time to myself, or if I need time to be with you guys, loved ones, friends. I find that to be wonderful because it really lets your body just like decompress, process everything, and then you can move on with what you have next going on. So that's something that I find that really helps, just to take care of myself, because I know nursing, even though I'm just now entering the new world of nursing in a couple of months, like if I can't take care of myself, I'm not going to be able to take care of others. So I think that's something I'm trying to work on now, so I don't burn out later on. We all know about nursing burnout, so yeah.
Absolutely. Thank you all so much. I'm going to hand off the reins to Christine. She has, I think, one or two more final questions, and then she'll wrap us up. I want to be mindful of everyone's time. So thank you all, and Christine, take it away.
Thank you, Caitlin. So we do have two questions from the audience today. The first one is, what can we do now if we are interested in pursuing oncology nursing?
Patrick, would you? Well, we do have free membership to ONS for student nurses. We have great opportunities for you to collaborate with other student nurses interested in oncology. You have your local chapter. So if you're looking for a mentor or a shadow opportunity or programs to continue your education, that is definitely a route that you can take. We offer Cancer Basics, a course for free, which also looks great on your resume. I mean, as a manager that used to hire new grads, anything that like, oh, you're passionate about oncology just like I am, you really care about these patients and you want to learn more, and that drive and motivation really spoke to me, that you really cared for this patient population just as much as I did, and wanted the best care for them. So those are a couple of things that I can think of. And then I know, Patrick, did you send out some information to them so they knew about ONS?
Everybody will get information probably tomorrow after we know who all was able to attend tonight's event. I'll be sending an email out to the representatives from your organizations, and then they'll distribute it to everybody that attended. So just so you know, like I said, like Erin had said, all pre-licensure nursing students, it's free to join ONS. And then if it's time for you to renew in a year and you're still a nursing student, you can still renew for free. And then if you've passed your NCLEX, your first 5 years of licensure will give you a discounted rate in your membership into ONS. So those of you that have already passed and are maybe in grad school right now, you're going to be able to get a discounted rate. You also receive from us, we're going to provide everybody with a discount for the purchase of a book from any one book from our bookstore. And we're also going to provide you a digital copy of one of our books as well. So that'll all be coming probably tomorrow for you once that gets distributed to the leaders of your organizations. And I wanted to just add something really quickly here on something that Alexa and Aaron and Kathy were talking about just a few minutes ago. And when Alexa brought up, going home and crying and everything. And now I want to stress now, I am not a nurse. But I share this story with students that are asking about oncology nursing because sometimes there's a stigma that oncology nursing is sad. And it's not something that I want to do because it's just too sad. I lost my mother to cancer 7 years ago, and that was prior to me working at the Oncology Nursing Society. And I would say that the only reason that I got through the 8 months that she was in the hospital was because of the nurses that were helping me. My mom lost all her mental faculties and wasn't able to talk to me or anything like that. And I had difference of opinion with the oncologist, but the nurses were the ones that were able to get me through it. They were the ones that called me every day to let me know what happened in the night shift so that I knew what questions to ask when I went into the hospital the next day to talk to her. They were the ones that told me whether she ate or not. They were the ones that cried with me in break rooms and wherever it was. So while oncology nursing can be sad at times, I want you to think back, if you think that, and look at how it's affected the family member of someone. I had now changed my career. I now work for an organization that dedicates our time to oncology nurses. And I'm sitting here 7 years later, and I can still tell you like the names of Judy and Rebecca and these nurses that spent all their time working with me through that. So it is tough and it is difficult, but you will change people's lives as a nurse, and especially on oncology nursing. So, I mean, that's something to take with you when you're having those days and those moments where it's just difficult. Remember, you are changing somebody's life for the better.
I would like to pick up on that. I was an ER nurse first. I floated out of nursing school to get experience, get my confidence up. My mentor advised that because I didn't know what I wanted to specialize in. And then I was an ER. And then I always wanted to be an oncology nurse because when I was in nursing school, you guys, we didn't even say the word cancer. In 1972, believe it or not, it was still the big C. And now last year was the last year I didn't renew my OCN because I've now specialized in performance improvement and quality and all that. But my message to you is that Aaron suggested shadowing. Oncology nursing has a continuum of care. I was a subspecialist in breast oncology for 30 years, developing breast centers. And I think from prevention and now with the population health and screening through treatment, it's not just chemo and it's not just hospice. It's a continuum of care in a very life affirming field of nursing. It's a subspecialty. So look beyond the chemo unit and the bone marrow transplant. It's highly complex with genetics all the way through grieving, like we just heard from Patrick, and taking care of the family. Thank you.
Thank you, Kathy, and thank you, everyone. Just realizing it's 7:06. I know we went a few minutes over, so thank you, everyone, for staying on. Quick thing is Christine is going to put the sign-up sheet back in the chat one more time. GNA students, I know this is a first time we've done this, but please feel free to fill that out so you can get credit for being here. And then that's how you'll get all of those excellent resources from Patrick as well. So we'll send those out probably over the weekend. I just want to say thank you to all of our panelists. You guys have been so amazing. A thank you to the planning committee with Carolina and Patrick, Christina, Serena, Ben, and I guess I'll thank myself as well. And then also shout out to Dean Baker. Thank you for being here with us. We appreciated your welcoming words in the beginning. And especially big shout out to Erin. She did the brunt of the talking for us today, so thank you so much. I just want to leave everyone with one final thought of, we're all going into nursing, and I think that the biggest thing is, whether it's self-care, nurse burnout, compassion fatigue, just don't forget the why. Don't forget the why, why you're doing it and why you chose to go into this amazing career. I hope everyone has a great night, and thank you all for being here.
Thank you. Nice to meet everybody.
Thank you all for the opportunity. We had a great time.